What's the latest on electronic data platforms and why are they important? Welcome to the CarePayments Podcast. I'm Fady Sahhar, and with me is Fady Sahhar, the co-author of the VPP blog and DEHQ.
Hey, everybody. As a reminder, the goal of the Care Payments Pod is to have a quick hitting but informative discussion about healthcare payment models and how they affect MCOs, providers, payers, and care recipients. As an advocacy first group, we want to make sure consumers have the best information and quality care as possible. So today we're going to focus on the basics. Let's start there. What are electronically collected measures?
Do we have only one podcast for this?
For now.
We will have. Let me start with some of the things that we all see being collected in the long-term services support space, and then we can talk about some physical health electronically collected data. So, as an organization interested in the quality of care, we're going to talk about tools like electronic visit verification. While on the surface, all that is when a caregiver clocks in, clocks out of the home, electronic visit verification is an evidence of care being delivered. And many of the tools in by the electronic visit verification platforms allow the caregiver to provide feedback to the healthcare plan and to the care manager. So that becomes a very useful passive way for the health plan to monitor what's going on. You also can tell whether people are missing shifts. That if we authorized a certain number of hours for a week because that's what we think the consumer needs, we're going to find out whether those shifts were actually delivered. But electronic visits can also be monitored in a variety of settings. So think about the reporting that of a visit to your primary care physician or a visit to when you're collecting data about health conditions. We're using tools that might give us insight on a consumer's diabetes scores or their heart rate or oxygen in their bloodstream. So these are really valuable tools that can be collected without having the nurses and doctors and the much higher cost professionals involved in the delivery of care. So these platforms are increasingly valuable for us as providers.
Wow. So I can imagine that there are a ton of nurses that could get some time back and how valuable that would be, as well as, giving us a higher quality of care. So other than those things, why are these measures so important?
Well, at a time when Medicaid services are under the microscope, these are the measures that allow us to address some of the regulatory oversight. The 21st Century Cures Act required that all services being delivered in the home be monitored so that we know when the service was delivered, how it was delivered. And at a time when everybody's concerned about overspending on Medicaid, this is a good way to avoid fraud, waste, and abuse. And we are able to utilize these tools very effectively to approach and support our consumers in the best way we know how.
That's extremely important, of course. So let's talk more about the passive collection. How do payers use these measures to create value-based programs?
Well, uh, think about it. We talked in an earlier podcast about our need to develop high performing providers. So, not everything can be collected, but through an interview. When we ask people to tell us what they do, they tell us how hard they work and how they have the most difficult job in the world. However, when you have passive measures like what we just talked about, whether it's electronic visit verification or utilization measurements, or caregiver performance, we are now able to assess how an agency or a provider is performing without actually having to sit across the desk from them. Not that we want to spy on them, These are the tools that allow us to look at what's going on with a consumer's life without actually having to be intervening on a daily basis or requiring the consumer to do anything different.
Right. I mean, the end goal is a higher quality of care. These tools allow us to give that higher quality of care or track
Yeah.
it.
And while we today focused on the LTSS aspect, we need to really think about all the other electronically collected measures out there. Uh, we have providers who are engaged in collecting data about care gaps. We have providers who are able to actually respond to changes in condition on the consumer's life. But going into the physical health space, where all this was started, the number of times you go to your PCP, how quickly the claims are processed, how quickly the results are distributed. If you've recently had any laboratory work, that it's shared electronically in a platform that allows other providers to take a look at what an independent physician or a laboratory monitored and integrate that into the whole person care, or more importantly, be able to participate in a value-based payment program that saves the plan money but also improves the quality of care.
Of course. This really touches back to our advocacy perspective, right? So I want to just touch on that before we finish up here. So we've discovered and talked about different EVV and electronic data platforms, how that can affect the LTSS population, and as well as save caregivers, nurses time and create value-based programs out of it. Did you have any other thoughts that you wanted to add as we finish up here?
Well, I'm also very excited about when I find out that providers are sharing some of this electronic information back with their consumers, when they're coming back and helping the consumer identify ways that they can continuously contribute to their quality of care, whether it's through remote patient monitoring tools, where a consumer could be monitoring their diabetes status or their heart rate, the number of times they walk. These are such tremendous tools that, whether you're doing it on a watch or whether you're doing it in an app, it becomes a very good way to engage consumers in their own care.
Awesome. Well, we promised quick hitting. We promised a fast podcast for you to learn about a topic on healthcare payments. And you can find a lot more on this at thevbpblog.com and dual eligible headquarters, which we create new content for weekly. So tons of new information for you to check out there. And you can subscribe to our podcast as well for free.
Well, we're excited about sharing all this information. Thank you for being with us today. And as always, onward.
The Care Payments Pod is brought to you by XtraGlobex. XtraGlobex is a strategic consulting firm that works with companies that are at an inflection point. We work with organizations to help manage that change and meet your goals. What is your challenge? Let us help take you onward. Link in the bio for a free consultation. Visit us at XtraGlobex.com.